Dr. Noe has been in private practice as a naturopathic physician since 1997, providing holistic primary medical care for the entire family. His emphasis is on botanical medicine, clinical nutrition, hormonal therapies, diet and lifestyle therapies, and corporate wellness programs. He is the past president of the Vermont Association of Naturopathic Physicians and a past director and officer of the American Association of Naturopathic Physicians. Dr. Noe is president of Green Mountain Wellness Solutions, Inc., an innovative and award-winning provider of comprehensive health and productivity management programs to small and large businesses throughout the state of Vermont. We are pleased to welcome Dr. Bernie Noe.
Thank you. It's a pleasure to be here. So I want to talk to you this morning about corporate wellness programs. And to begin with, I'd like to try to make the business case for why you should care about corporate wellness. And the short answer to that, pardon my poetic license here, is that if you give a man a drug, he's healthy for a day. If you teach a man a healthy lifestyle, he's healthy for a lifetime. And that, I think, sums it up pretty well. The next short answer is that it's a win-win-win-win solution. The employer wins because they reduce healthcare costs and other indirect healthcare costs. The employee wins because they are healthier and happier. The physician-provider wins because it builds a practice, it provides income to the practice, an additional revenue stream. And our healthcare system wins because we're finally doing something productive about the healthcare crisis we're experiencing. This chart, I think, sums up pretty well, as well, why the problem that we're faced with. This is a projection of healthcare costs going out, well, the data, it was produced in 2001 by the Center for Medicare Services. And the summary of this chart is that over the next 10 years, healthcare costs are estimated to double. So if you think the problem's bad now, just wait another 10 years, then it's going to be really bad. So a bit of a good news, bad news scenario. That last slide was bad news. This is good news or bad news, I suppose, depending on how you look at it. The prevalence of lifestyle-related risks in this country is very high. You can see that for overweight or obesity, physical inactivity, and poor diet, it's between 60 and 80%. That's the bad news. The good news is, if those numbers were very low, there'd be very little we could do about the healthcare crisis. So this demonstrates that a way we can approach that crisis. This also, I would say, is good news. Good news, bad news. The bad news is that for 4 of the major chronic disease categories that we experience in this country and the major cost drivers for healthcare, lifestyle-related risks are very prevalent, 70 to 90%. The good news is, once again, that gives us an opportunity to do something about that. So we know that these diseases are costly and prevalent, and this, I believe, on a very basic level, demonstrates, again, that there's something that we can do about that. When we're talking about corporate wellness and healthcare costs, it's important to understand a few basic terms. I think Ms. Zavik a few moments ago was talking about absenteeism and presenteeism. I think apparently some of those terms were defined at last year's conference, but I want to just do a quick refresher on that. There are 2 broad categories of costs that we look at in a business. Direct medical costs, pharmacy, hospitalization, office visits, and so on. And then indirect healthcare costs, such as absenteeism, workers' compensation, short and long-term disability, employee turnover, and presenteeism. Presenteeism is a term that's used to define an employee who has health risks and is unhealthy, and as a result of that is less productive at work. So you can essentially think of this as productivity. A good example of this would be migraines. Migraines, with the data I've seen, are the most costliest disease state there is in terms of the presenteeism costs. About $11,000 a year, I think, is the number that I recall seeing. And you can imagine someone that has a migraine and is at work is not going to be fully productive. That's presenteeism. Presenteeism is particularly important because when we look at how do these different types of healthcare costs factor into the total employee healthcare cost equation, what we see is that the direct medical cost, the medical and pharmacy, the gray area here, only accounts for about 25% of the health-related costs. 75% are those indirect related costs, and of that 75%, presenteeism, as you can see, is the major driver for those costs. So the next logical question to ask is there any data that quantifies how these risks impact costs? And there is quite a bit of research that's been done in the last 10 to 15 years. This is data from the Health Enhancement Research Organization, the HERO group, or the HERO study. They're a great organization. They've worked with a number of Fortune 500 companies. Motorola, I think, was one of them, and some others. And they've actually done a couple of different studies right now. Their initial landmark study was looking at, boy, it's been a few years. I believe it's roughly 50 to 60,000 employees. Don't quote me on that number. Over the course of 3 years. And what they attempted to do was establish the relationship between health risks and direct healthcare costs. And what they found is that psychosocial risks accounted for the two most expensive individual disease state categories. So those with depression, 70% higher healthcare costs. Those that are under high-risk stress. So this is just not someone who's under stress. This is someone who's under stress and is being impacted by that stress, over 40%. And then you can see individual risk, non-psychosocial risk factors like high blood pressure and overweight and current former tobacco use and blood pressure and exercise. This is not what I would have expected to see. Exercise certainly has an impact, but I never would have guessed that would have the least impact of these other categories. There are, the HERO group has also started to do some research into those indirect healthcare costs, the presenteeism and the absenteeism and compensation, and workers' comp and so on. The data is a lot spottier on the indirect costs, and there are some other researchers that have done it as well, and I'll have some other data on that in a minute. This is from another group of researchers, Dee Eddington and his group at the University of Michigan Health Research Center. They're also doing some great work. And they looked at it a little different way. Rather than looking at so much at individual risks, they looked at the number of risks that an individual has. And they used things like high blood pressure. They also used things like illness days greater than 5 times per year, unsatisfied with job, unsatisfied with life, overall poor physical health, as well as individual medical risk factors. What they showed is probably common sense, but nonetheless, it's nice to see that common sense actually agrees with reality, it appears in this case. What they found is that the more risks that a person had, the higher their healthcare costs were. And for those in the highest risk category, 5 or more risk, it's almost $2,000 annually. Likewise, as you reduce risk, you, in general, reduce cost. Again, it's common sense, but it's borne out in this study. So we know that these disease states are prevalent. We know that they are costly. The next question for me to ask anyway is, do we know that we can do anything about that? We think we can because we know those lifestyle risks are there. But is there any data to show that we actually can do something about that? And the good news, once again, yes, there is data that supports that. These first 2 bars are from a study. The lead author was Stephen Aldana. He's a researcher at Brigham Young University, and he's done a lot of work in the area of corporate and worksite wellness. And this was a meta-study pulling approximately 75 studies. And he looked at the return on investment in terms of direct healthcare costs and absenteeism. And what he found is that on average, among the studies he looked at, $3.48 was saved for every dollar invested in terms of the direct healthcare costs, and $5.82 was saved in terms of absenteeism. Now, this next bar is a rough estimate. That was not a part of his study. There isn't a good, large meta-study that I've been able to find anyway that really looked at presenteeism, return on investment. But in general, the estimates are that the potential savings from presenteeism are 2 to 3 times the potential savings from the direct medical care cost. So I basically multiplied the $3.48 by 2.5 and came up with $8.75. So that's why I say it's my own rough estimate. Total potential savings, $18 saved for every dollar invested. This is a really good investment. All right, there we go. One of the next questions to ask is, so now we know that we can save money. How much money should we spend on corporate wellness? And there's only a little bit of data that I've seen in this area. This is not published data. This is from a presentation given by David Anderson of Staywell Health Management. Staywell, for those of you who don't know, is a nationwide provider of corporate wellness to large companies for the most part, those with above 10,000 employees, I believe. And they have their own internal data in which they've attempted to establish a relationship between how much is spent on employee wellness and what the return is. And as you can see, that for an investment of $10 per employee, the return on investment is $10 saved for every dollar invested, for a net savings per employee of $90. And as you invest more and more, up to $300 per employee, you continue, the return on investment goes down to 3 to 1, but you still save more, $600 saved for an investment of $300. If you go up to $600, you actually start decreasing your return. So based on their data, the optimal investment is $300 per employee. Again, this is their own internal data. There is other data that I have seen from the same group where they have identified that for an investment of $300 per employee, their experience is that you can flatline healthcare costs. In other words, you can take the annual increases of roughly 7 to 8%, which is what the Center for Medicare Services is projecting, and you can turn that into zero. That's the data that they have shown from their program. I don't have that data here. And again, it's not published anyway. It's their own internal data. Oh, too far. What I've done here is attempted to show you the total cost impact for an employee for a company with 200 employees. And what I've done is I've taken the HERO data to calculate, and actually not some of this data is from other studies as well. The HERO study did not look at asthma and back pain, but they did look at these risks up here. And from the HERO study, we know that we can convert that percentage into a number. And for blood pressure, the number is roughly $750 a year in excess healthcare related costs for someone with high blood pressure. We can use national prevalence to determine how many people in this company of 200 employees are likely to have these various risks. For blood pressure, it was 127. And by the way, this isn't just for these 200 employees, it's also for the 120 spouses that on average would also be on that health plan. So 127 people will be likely to have high blood pressure. We know what the approximate or estimated cost is from the HERO and other studies. That comes out to $23,000 per year in excess health-related costs for high blood pressure alone. And then done that for all these other risks as well. And you can see that the total cost impact is almost $500,000 for a company of 200 employees in terms of the direct healthcare costs. I've also done the same thing for these indirect costs. As I mentioned, the HERO study, the HERO group has done some research into these excess presenteeism costs based on health risk. And these numbers are pulled from a variety of different studies. Most of these numbers are pulled from the HERO study. These numbers are pulled from 4 to 6 different studies, so the numbers are a lot more spread out. But again, estimates of the indirect healthcare costs, this is only for presenteeism and absenteeism. It doesn't include workers' comp, disability. Actually, some of these numbers might include disability. It doesn't include employee turnover. Absenteeism is the best studied in terms of the indirect healthcare cost, probably because it's the easiest to quantify. Presenteeism can be very difficult to quantify. If you're a company that makes widgets, it's maybe not all that hard to quantify, but for more of a knowledge-based company, it can be very difficult to quantify. And there are tools now available that are designed to measure the cost impact of presenteeism, and they're starting to come into wider use. But nonetheless, it's a much harder thing to measure. So again, for these indirect healthcare costs for this company of 200 employees, we would estimate that their excess health-related indirect costs are $1.2 million. Total cost impact, $1.5 million. So this is an opportunity. Company of 200 employees, the opportunity for annual savings is $1.5 million if you could eliminate every single one of those risks. Now, obviously, we're not going to eliminate every single one of those risks. But if you can reduce the risk by 50%, then obviously we can have some pretty substantial savings. What I'd like to do now is talk about the program that we developed for the Vermont Automobile Dealers Association, just to give you a sense of what a program might look like and how it can be done. The VADA is a group of 170 auto dealerships spread all over the state of Vermont. Of those 170 dealerships, about 100 participate in a health insurance trust run by their trade association, the VADA. And what they found is their healthcare costs were going through the roof in this health trust, and they wanted to try to do something about those increases. And what happens is each dealership buys an insurance plan, a health plan for their employees from this self-funded trust that they administer as an association. So they are directly impacted by their healthcare costs. It's not an insurance plan, it's a self-funded plan. And one of the things that we're very proud about is in the very first year of their program, they received Vermont's top worksite wellness award for large businesses, the gold medal worksite wellness award. And this is a picture of that award being given by Governor James Douglas. In the second year of the program, they did the same thing again. They also got the top worksite wellness award. In the third year of the program, they did as well. That was just about 2 weeks ago, and we don't yet have a picture from that event, so I haven't included a slide here. But all 3 years in a row, they've received the top worksite wellness award. And this is a group of businesses that are small employers. In aggregate, they amount to about 2,000 employees. But the average dealership has 25 to 30 employees. So one of the things that's fairly unique about this program is for companies of that size to be able to have access to any wellness program, much less a program of this caliber. And the fact that they were able to do that with not much funding compared to many other programs is rather impressive, I think. They beat out companies like IBM and General Dynamics and General Electric and the largest hospital in the state and the University of Vermont and some other colleges in the state to get this award. One of the key things that their program includes are annual on-site wellness screenings. So we send lifestyle educators, nurses, to each business that elects to participate. Now, because there are 100 individual employers, even though each employer is offered this program, not all of them elect to participate. So we send someone on site every year. We measure total cholesterol, HDL, glucose, height, weight, blood pressure, waist circumference, body mass index. And one of the things that allows us to do is to identify an individual's risks and counsel them right then and there about how to change those risks. That counseling component is very, very important because, let's face it, in most physician offices, counseling doesn't really happen. A patient might get the recommendation, you need to lose weight, or you need to be more active, or you need to eat less fat. But in most offices, many practices here excluded, I'm sure, that's the extent of the advice. That's just not enough for most people, unfortunately. An example of this is a comment that we got from a screening participant at one of the auto dealerships last year. And she told our screener that she had learned more at her wellness screening than she had learned in 10 years of going to her primary care physician. So it can be very powerful, what we can do with those screenings. In addition to identifying that employee's risk, both for themselves and for the wellness program, and helping them to identify and motivate them and help them understand how to make those changes, it also allows us to collect data that we can use to track the outcomes of the program. And that's what this slide is about. So because we're going back and measuring every year, we can monitor changes, trends in high blood pressure. And that's the first one here. 30% reduction in the incidence of hypertension in the first 3 years of that program. This is key because we identified in the very first screening that for this group, their incidence of high blood pressure was much, much higher than the national average. It was roughly 34, 35% compared to roughly 25% for the national average for adults. And so we focused their programming very heavily on high blood pressure as well as heart disease and diabetes. And we were able to see a 30% reduction in that first 3 years. Cholesterol didn't change very much, only a 2% reduction in that, unfortunately. But multiple risks for heart disease reduced by 36%. So this is we define this category the same way that the HERO study defined this category. I didn't mention that in that study, in addition to individual risk factors, they also looked at combinations of risk factors. Multiple cardiovascular disease is a combination of high blood pressure, high cholesterol, overweight or obesity, physical inactivity, smoking, high stress, physical inactivity, if I didn't mention that. I think I've got everything. 3 or more of those risks equals multiple cardiovascular disease risk factor in that HERO study. And we've used the same definition here. So a 36% reduction in those people with 3 or more of those risks. What you can see here with the obesity and overweight is interesting, but maybe not all that surprising. What we saw is that obesity went down and overweight went up. And what happened is these people that were in the highest risk category, the obese category moved into the overweight category. So far, we haven't been successful in getting people to move out of these categories in combination, but we have been successful at least starting to get people to shift towards a lower weight risk category. We, just this year, have redesigned their program to start now placing an additional emphasis on obesity and overweight. And one of the things I'll mention later on is that they had this spring, they had their first weight loss challenge for a group competition between these different dealerships. In aggregate, they lost over 1,200 pounds, so we're pretty happy about that. Incidence of diabetes went down by 14%. Physical inactivity, 32% reduction. This is also key because this is one of the other primary areas we identified that we wanted to address. Even though in that HERO study results that I showed you earlier on, they only showed a 10% increase in cost from physical inactivity, we know that physical inactivity affects high blood pressure, high cholesterol, multiple risks for heart disease, obesity and overweight, diabetes, probably depression, excessive stress. So we wanted to place an emphasis on this because we can impact the vast majority of the risk categories all at once. And there was a 32% reduction in people who are inadequately physically active. Depression went down by 50%. That is, again, the single most costliest direct healthcare-related item risk based on the HERO study. And then excessive stress went down by 12%. When you look at how that translates into dollars, what we've done is using that same data I was showing you earlier, the HERO study for the direct medical cost as well as a few other studies, and the indirect presenteeism cost, what we found is that they saved an estimated $663,000 in the first 3 years of the program, $1.1 million in terms of the indirect, in aggregate $1.8 million saved. So they're pretty happy with this program. Oh, did I go the wrong way? No, that must be a repeat of that slide. That shouldn't be there. So that previous slide was an estimate. This is actual healthcare cost data from their claims experience. This is prior to program inception. Right here is program inception. Here's the last 3 years. And you can see that their healthcare costs have still increased. They're only spending about $30 to $50 a year per person, far below that $300 that I mentioned. Nevertheless, they've significantly bent the curve on their cost increases for healthcare. So their program has included, as I mentioned, the screenings, annual physical activity challenge, monthly wellness newsletter, and annual flu clinics. New for this year was the weight loss challenge that I mentioned, a therapeutic lifestyle change program where we send lifestyle educators on site and work with people in small groups, primarily for those with metabolic syndrome or related risk factors. We haven't actually done that yet. That's in the plan for this year. We have approval to do it, but so far we're not finding the right way to get people interested in signing up for that program, so we're still working on that. A new incentive program for this year, 8 out of 10 criteria. If they meet 10 criteria, if they meet at least 8 criteria, they get an award, get entered for a drawing in $10,000 worth of cash to try to promote participation in the programs. And then they have a new online wellness center that allows them to, has a symptom checker so they can go in and see, well, if I have a fever and abdominal pain, what do I need to do about that? Or they can get lots of health information from that website. Other programs that can be run include things like smoking cessation programs, lunch and learn sessions, self-care manuals, targeted health information, disease management programs. So there are a lot of different types of things that can be done. What I've described mostly is what we have done for them. Now, in terms of the research that's looked at, what are the best practices in worksite wellness? What do the best programs include? There are 3 categories of programming that we look at: awareness, behavior change, and supportive environments. Awareness might be a newsletter. It might be showing up and doing a wellness screening and identifying whether the individual has high blood pressure, for example. Targeted mailings, self-care manuals, things of that nature. Behavior change would be something like an employee challenge, getting, again, groups of these employees in a friendly competition to be physically active or to lose weight, or a smoking cessation program. And then a supportive environment would be changing either the work environment or the societal or cultural environment or the home environment to better promote healthy behaviors. So an example of some unhealthy environments would be junk food in the vending machine at work, or 30 minutes for lunch so an employee doesn't have enough time to go out and walk over lunch, which is a common scenario at a lot of these dealerships. Or moving sidewalks in the airport so that you can do that instead of walking. And I think I've pretty well described that. There are a couple examples. One of those is smoking. This is a good example of changing the cultural or societal environment to one that discourages smoking instead of encourages smoking. And that's been a real success case. The incidence of smoking has been cut in half from about 50% to about 25% as a result of that public education effort and workplace policies and so on. Another one is seatbelt use, dramatic increase in seatbelt use because of laws. These can be laws, they can be policies, they can be workplace things, any number of different types of things. It's about creating a culture of health in an organization. And that really starts at the top, as I'm going to explain here in just a second. I've got 9 points for you. In terms of, this is the hardest thing to do, by the way. Building supportive environments has usually the greatest potential impact on a corporation's costs. But it's also the hardest thing to do. One of the things that's really key is support from top management. That means management needs to participate in all of the program. They need to not just participate, they need to be cheerleaders and example setters for those programs. It needs to be incorporated into the policies and procedures. Not just top management, but all management needs to get involved and be supportive of this program. An example I'll give is a dealership Saturn dealership in Burlington, Vermont. The first screening I went to, this was 3 years ago, and the group benefits manager was going around and talking to each and every employee, trying to get them to participate in their wellness screening. As a result, they had 90% participation, which and the average participation was 50%. That individual also went to the length of sitting with an employee who was afraid to have the finger stick for the cholesterol and glucose, and sitting with her and holding her hand while she had her finger stick done. So she participated in that. That's an example of how management support can really make or break a program. Supervisors also need to know their responsibilities and be involved in changing the environment towards, for example, a lower stress environment. Peer support teams, very important. Employees, again, you need buy-in at all levels, not just management, but employees as well. Creating a health and fitness friendly environment. That might include an on-site fitness center, that might include walking paths, it might just include a map to show people where they can walk, different walking courses over lunch. They can be expensive things like a fitness center, or they can be very simple and inexpensive things like a walking map. Policies around tobacco use, safety belt usage, particularly generally for these auto dealerships, they have employees driving around a lot to deliver cars and so on. Providing as many opportunities as possible for employees to participate is very key. It works best if it's done at the work site instead of off-site, because if employees have to travel, they're less likely to do it. Multiple opportunities, not just one single event every year, but showing up frequently and offering different types of programs for different people. The benefit program should be designed to encourage participation, and ongoing awareness efforts are really key. We know that if you do this and you show up once and then you don't come back for a year or 2 years or 3 years, you're going to lose steam and not achieve the results that you want to achieve. So the last thing that I want to talk about is how you might be able to do this yourself. Speaking for myself as a naturopathic physician, I got extensive training in medical school on how to work with diet and lifestyle and exercise therapies with patients one at a time. I got little to no training about how to work with people, 100 or 1,000 people at a time. Didn't get that much training in behavior change theory, although my understanding is they're starting to teach that a lot more in the naturopathic medical schools now. These are things that you need to know if you're going to design a wellness program. Even if you've got the basics about knowing what people need to do, there's a big leap from knowing what people need to do and understanding how to help them do that in a corporate setting. So one model is you do everything yourself like I did. You can develop all the tools, protocols, procedures, purchase the equipment, and so on. A second model is you can do some of it yourself. So you can be basically the general contractor. There are many companies out there that will sell you a health risk appraisal. There are many companies out there that you can contract with to have them show up on site and do a flu clinic or a wellness screening. There are many companies out there that produce wellness newsletters that have usually very limited options for customizations that you can purchase for the companies. So that's one model. Design the overall structure for the program, but contract out or work with other companies to provide some of the individual programming elements of that program. And then the third category is to really look for a provider that can offer a turnkey solution. This is for the provider that's pretty busy and doesn't have a lot of time or maybe expertise to be able to do this, but wants to get involved in wellness. There are companies out there that can work with you to help you do this. There are actually quite a few companies. An example of a turnkey operation might be that you as a provider go out and identify the market, identify the businesses, sell them on a program, and then provide some of the on-site programming like disease management services or a lifestyle change program or lunch and learn sessions, whereas the turnkey provider does the other things that are more complex, let's say, or not necessarily more complex, but require more training and resources, things like an employee challenge or the protocols for a wellness screening or a wellness newsletter and so on. And then lastly here, what I've got for you, I'm not going to run through these, is just a list of resources, different companies, organizations that provide tools that can help you do this. Some of these are information like the HERO, it might be on the next slide, the HERO organization is up here, the Health Management Research Center is on here, some membership organizations like WellCOA and National Wellness Institute. I'm not going to go through all these, but there are a lot of great resources here to help you if you want to embark on this venture. There we go. That's the end. Thank you.